Every year I have a mammogram done. I do it during the month of my birth as a birthday present to myself. And I've been doing this since I was in my 40s. And every year they come back okay. And this one time they did not. They came back showing some microcalcifications, which Dr. Boravaj was concerned about because there were more of them than should be there. The technologist brought the mammograms into Dr. Boravaj, and then Dr. Boravaj came out and got me and brought me in and showed me the areas of concern.
When Carol appeared for her annual yearly mammogram, I noted that there had been a change that required additional studies being performed. One of the important aspects of the Leahy-Hitchcock Clinic in Manchester is that we have a system in place so that if a problem is noted by either the technologist or myself, the area can be worked up while the patient is still here in the clinic and then can be referred to the surgery department for evaluation.
When they told me that they had to look a little bit further, it was very upsetting to me because I had expected this mammogram to be normal as all the other ones had been, and this one was not.
The Leahy-Hitchcock Clinic, a not-for-profit group practice of multi-specialties. So what does that mean? Well, that we're healthcare professionals working in partnership to provide comprehensive, integrated, and coordinated care for our community, Manchester, New Hampshire. As a multi-specialty group located in a single facility, we've committed ourselves to a set of values that include teamwork, collaboration, compassion, integrity, innovation, learning, teaching, and responsibility. But how can any medical institution fulfill such lofty goals at a time when there's so much pressure to control costs and when the role of the physician is changing so dramatically? Well, let's look at two of our values, teamwork and collaboration, which strike at the very core of the Leahy-Hitchcock Clinic's mission.
The new mammogram showed 7 specks of calcifications that had not been present on Carol's prior mammogram. I felt it was important that these calcifications be biopsied. I was able to talk with her, discuss my findings and recommendations right then and there. She next was able to discuss these findings further with Dr. Knapp.
Carol's situation was a little bit unusual. She wanted to postpone her biopsy for about a week until a vacation time. Most of the women we see, though, feel that the wait between finding out that they have a problem and doing something about it are the longest and hardest days of their life. Now, the advantage of being in a clinic situation as we are is that we have all the tools available to answer those needs in a very, very timely fashion. The primary care physician can call radiology and expect to have a mammogram done the same day. If the radiologist feels that a biopsy is indicated, the patient can be seen again later that same day. They'll often have the biopsy, if not that day, within a day or two following that. And we've been able to cut down that cycle time for the patients, and I think it's worked very well.
In a multi-specialty clinic, you have one clinical record. In that record is the appointment you had with the dermatologist, with the surgeon, the history of the operation you had, the medications you are on, the medications you've had reactions to in the past, things that only one would know if everything is in one place. So when I send you off to see that next specialist, he or she will have the whole